Good afternoon, everybody. Happy Monday with the sun shining despite there being snow on the ground in this part of the state. Welcome to our COVID-19 update for the day. We are on Monday, Wednesday, Friday schedule now, so we are here today and we will be back on Wednesday and Friday just as a reminder. Today we are fortunate again to have the health officers from Dunn County and Chippewa County here to share with you. We really, across the state, are working together as local health departments and emergency management. And in this region, we have really common population that crosses between all of our communities, and we really approach things as a Chippewa Valley, and so it's really nice to have them here to share with you perspective as well. I will give a little bit of an update about Wisconsin, and then Chippewa and Dunn County, Angie and KT will share. I'll come back and talk a little bit about updates in Eau Claire, and then we'll take questions at the end. In Wisconsin, there are now 3,420 positive cases for COVID-19, 36,769 negative tests, and 154 deaths. Again, each one of those data points is a person, both the positive tests, the negative tests, as well as the deaths, and certainly our thoughts are with those individuals that have been so severely impacted by this disease. The state is now reporting hospitalizations of 993 individuals. And a reminder that the number of cases and deaths are increasing in the state. They're increasing at a lower rate than what we expected prior to starting the safer at home practices that we have in place. And really the sense at this point in time is that that is helping us. People staying home, keeping their circles small is making a difference. And certainly while we still have people significantly impacted by COVID-19, it's at a rate that is lower than what we were expecting if we wouldn't have done this. The idea is to keep those numbers low so that hospitalization rates are at a level that can be managed in this community and across the state. As long as we do that, we will have providers available to meet the needs of people that need that kind of care. Staying with the safer at home order is what we all need to do. I know it's hard. It's been a long go and continues to be difficult, but it's important if we want to really work on this disease not having as big of an impact. In the state, there are now 23 laboratories that are doing COVID-19 testing, and we have a capacity of 3,886 tests being done per day. So again, capacity is increasing. The state, as we indicated last week, is opening up the testing criteria and really encouraging additional testing to happen. Today, we also know that election results will be coming. The election did happen in person last Tuesday. Ballots continue to come in until 4 o'clock today that will be counted, those that have arrived. And we know that those results will be coming in later today. As I indicated earlier, moving forward, there will be tracking in our electronic disease surveillance system, the system that we use to track cases, to see if there are connections to further cases related to the election process. So that is something that is in place moving forward. So I will now invite Angie up to share a little bit about what's happening in Chippewa County, and then KT will follow Angie, and then I'll be back to talk about Eau Claire information.
Thank you, Lisa, and thank you to Eau Claire County for having Chippewa and Dunn counties join. Good afternoon. My name is Angie Weideman, and I'm the Public Health Director for Chippewa County. I wanted to give an update on the COVID-19 situation in Chippewa County. As of today, we have 20 confirmed positive cases in Chippewa County. We have 605 total negative cases, 12 cases that are pending, and there have been a total of 656 total tests given in Chippewa County. All our age ranges in Chippewa County are range from the 20s to the 70s, and all cases are currently working with the health department to ensure the safety of all of our residents. While the governor and public health officials are asking everyone to stay at home, we recognize that families are spending more time together than usual. The isolation and anxiety may be creating unhealthy households for some. If you are isolated, please try to maintain social connections online or over the phone if it is safe to do so, and try to stick to your daily routines as much as possible. In this time of uncertainty, your physical and mental health are of the utmost importance to us. If you are in a situation in which you feel unsafe, all of our communities have resources available to help. In Eau Claire County, Bolton Refuge House remains open and has advocates available 24/7. In Chippewa County, Family Support Center is available and has advocates there 24/7. And in Dunn County, Bridge to Hope is available. Law enforcement is also always available to be called. And please remember, you are not alone. There are many people in the communities ready to help. Now I would like to introduce Katie Gallagher from Dunn County.
Thanks, Angie. My name is Katie Gallagher, and I am the Dunn County Health Department Director. Again, I want to give a bit of a situational update for Dunn County and then talk a little bit about those things that we want folks to tuck away. So in Dunn County, we have had 574 people test negative for COVID-19. We've had 9 people in Dunn County test positive. Of those 9 people, we have 3 people who have recovered. We have 2 people that are hospitalized, that is an increase of 1. And then we have 4 people that are, again, working with the health department, isolating at home and keeping them and their loved ones safe. So I want to talk a little bit about essential and non-essential travel. So we are able to leave our homes for essential travel. Picking things up from the grocery store, maybe getting a couple things from the hardware store to fix something that's not quite right in your home. But we want to make sure that we're not traveling for non-essential travel. And so that non-essential travel can look like a couple things. It can look like going up north, heading out to a cabin or a second home, going over to a rental property, again, for non-essential issues. We still want people to get out and take care of people that maybe can't take care of themselves. We want people to get out if they need to get health care, especially if it's emergent. And again, those essential items. But we want people to recognize that when they travel to a second home or a cabin, they're leaving the places that they have potentially been exposed to COVID-19, and they're taking their germs with them to a place that may not have the infrastructure. It may not have the medical services. It may not have the emergency medical service or EMS firefighters that really can support them if they were to, after their incubation period, become ill, need emergent health care. You're safer at home. Your communities are safer if you stay in your first home than when you travel. We want to make sure that if you have to go to your second home, so say for example, you're coming from someplace else a little warmer than here and you don't have someplace else to stay and you make it up north, we want you to quarantine at home 14 days. That means to bring all the things you need for 14 days. All the essential food and supplies that you need to keep you in that second place for 14 days. That's important. Keep our community safe. As you've already heard, we are seeing maybe a reduction in what was initially trended in the number of new cases daily. That's initial indication that it's staying at home is paying off. But we're not done. We need to stay the course. That might be for a little bit, that might be for longer. but we need to stay the course. We need to make sure that we are supporting local businesses when and if possible. That might be curbside to go. That might be ordering a half of a side of beef when you've never ordered that much to fill your freezer. Supporting local agriculture. That might also be making online purchases that support our artist class and our merchant class here in the Chippewa Valley. Support our businesses, stay the course, stay home. And then for folks that are really struggling, because your hours have been cut, because you are staying home, you don't have the clients, you're a non-essential business, we appreciate you, and we appreciate that you're staying the course and you're staying home to keep your community safe. But also know you're not alone. The people in your county care for you, and we're here to help you. Talk to economic support, and whatever your county is of residents. Talk to the amazing people at WIC if you have children under 4 or if you're pregnant. Talk to your Chamber of Commerce. They can help set you up with different business options and point you in the way. Talk to your HR professionals. Let them know that you have questions about expanded FMLA or the CARES Act. We're in this together, and we are all safer at home. Thank you.
Thank you, Angie and KT. Some quick updates from Eau Claire, and then I will share a bit more of information more broadly about what's going on, and then we'll have opportunity for questions. In Eau Claire County, we continue to have 21 confirmed cases of COVID-19 by testing in Eau Claire for Eau Claire County residents. This has not changed. Our testing numbers are at 1,236 individuals. Eau Claire County residents tested, an increase of 76 since we last reported, and 1,154 individuals that are negative, so that's an increase of 121 negative results back. It's good news that we have no positives continuing in Eau Claire, but it's important to remember that we have everybody in Eau Claire County that is potentially at risk. Again, none of us have immunity to this disease except those people that already have gotten it who may have some level of immunity. It's a reminder that this is a new disease for everybody. And as we have the Safer at Home order in place, we have fewer people we are potentially exposed to and exposing. But we need, as Katie and Angie have reiterated, to make sure that we are following that. We are concerned about the spread of disease, especially as the order gets lifted, when and if that happens. And we need to remember that this is a real disease with real implications, particularly for our most vulnerable populations. Our call center since Friday has had about 27 calls, fewer calls. We know that depending on the news that is out there, we may get more calls as things go on. But a reminder that that call center number for Eau Claire people to call is 715-831-7425. We also know that those people that are in long-term care or assisted living facilities are at particular risk. Last week we talked a little bit about the importance of providing support to individuals that are in those facilities and how important it is that we are reaching out in the many ways that we have available to us to give support to people that may feel isolated because visitation has changed significantly. Those in those facilities, long-term care and assisted living, are some of the people that we're most concerned about with this disease. I sent a message out broadly on Friday, strongly encouraging those facilities to continue to take the strongest measures possible to not have people be outside their buildings, be in situations where the risk could be there for people to be exposed. We are continuing to support that and wanting really all families to understand why this is very, very difficult. It is also critically important that the reach out to family members happens via technology and not in person. It's hard. It's also hard to see people in that age group dying from this disease, and we need to pay attention to that. There are ways that we can protect them, and not exposing them by having face-to-face contact is the best way to do that. A reminder as well that Eau Claire continues to have childcare available for our essential workforce, and if that's needed, people are encouraged to contact the Wisconsin Department of Children and Families Regional Office if essential service workers need that assistance. Again, the website has more information as people have that need. I also would like to say that over the weekend we spent some time thinking about the severe weather, and this is a period of time where, yes, we may have a major snowstorm, but we also may have other severe weather. And certainly during times of COVID-19, we have to pay attention to the fact that a shelter for a tornado or for a big loss of power is entirely different than how we might do it when we don't have a communicable disease like this present. So do know that that is something that we also are working on here and across the region. It's important to stay home. Thank you to everybody that's doing that. I hope those people that celebrated family traditions and faith traditions this weekend found some joy in that. And thank you to the essential workers that still were working this weekend and did the work that was needed in order for others to have a break. And at this point, we will take questions. Yeah.
Once the order ends, whether it's in a couple weeks or whenever, has it been discussed how it's going to look reopening stuff? Is it going to be like little by little to see like how things react to it, or is it going to be just everything's open like immediately?
Yeah, so the question really is related to the Safer at Home order. What might happen next related to that order? We certainly don't know yet at this point. There's lots of work happening at the state level as well as states across the U.S. to look at the measure, which is one of the classic public health measures of having people not expose themselves or others by getting into a small group, what we're doing now, and what the best next steps are after that. We are anticipating seeing some loosening of the Safer at Home order at some point in the near future. Possibly will not be a full ending of the order, and that's certainly part of the conversation that's happening right now. We know that there are some activities that are in some populations that are more at risk, so I would not be surprised if there are some work done around particularly those populations and group sizes again. Other questions? Yes.
Lisa, can you talk at all a little bit more about the shelter idea? I hadn't thought of that, but that would be incredibly problematic.
Yeah, so the question was talk a little bit more about the shelter idea. Certainly in a usual disaster, a sheltering option might be something that's needed. Isn't often in our environments utilized to a large extent. Certainly in hurricane areas and other areas, a shelter might be something that people are in for longer periods of time. But working with the Red Cross and emergency management, we did have a number of conversations yesterday about what would happen if we would need something on a larger scale, if there was a large-scale power outage for an extended period of time where people couldn't stay in their own homes. We would have to really work through the balance of risk of exposing a group of people to not having a place that was safe to live at home. So in every situation, and I think across our state, it would be a close collaboration between emergency management, Red Cross, and the health department to really come up like we do in other congregate settings now, whether it's a shelter for people experiencing homelessness or another kind of group setting. All those ways we can make sure physical distance continues and separation of people that are, for some reason, not well. Yeah.
You said the state was loosening the priorities for testing.
Mm-hmm.
Before in broad strokes, it was like the healthcare workers and people who were hospitalized. Now, even if someone isn't ill enough to be hospitalized, should they, go seek a test? Might they be able to get a test in Eau Claire County?
Right. So the question was really around testing. We do have more testing capacity in the state than we have tests being run on a daily basis. And that's something that the state has been talking about for the last few days. There certainly last week was an opening up of and an encouragement of increased testing happening. State Lab of Hygiene, our public health labs, are still prioritizing specific tests that they are doing. So those are for the highest risk individuals, hospitalized healthcare workers, and individuals from specific congregate settings, places like prisons and jails, as well as long-term care facilities. Those are prioritized tests still. That group list did expand a bit to include more than just healthcare workers and hospitalized individuals. The state at the same time did encourage testing to happen based on clinician decision for those with symptoms to also be considered for testing where that capacity existed. So in this area, in the Chippewa Valley, we do have a number of test sites and a number of possible locations for testing to happen, and certainly we are encouraging where it makes sense for clinicians to test individuals with symptoms.
And just a quick follow-up on that, Marshfield is doing testing here, Mayo is sending tests to Rochester. Do you know of any other places in the immediate Chippewa Valley that are running tests?
So the question is, do we know of anybody else in the Chippewa Valley besides Marshfield running tests locally, where tests are being run here, not just being collected here? I'm not aware of other tests being run locally. State Lab of Hygiene, Mayo, and Rochester remain in this area at least the primary places where tests are being run, although we are seeing increased tests done by Marshfield and other providers as well. Certainly one of the things related to testing that all of us are looking at is as testing numbers increase, if we get to that 3,800 statewide testing capacity, and we actually have that many tests being run a day, we may see increased positives. And so for all of us that are doing the investigation of those positive cases and all of the contact follow-up, that is an important strategy that is being talked about a lot. People may hear about language being used about contact tracing. Again, one of the classic public health jobs that we do is talking intensively to the case, the person that has the disease, and making sure we know anybody that they were in close contact with so that we really limit spread. And moving forward, in order to prevent large second waves and third waves, we will have to have the capacity to really make sure that we do full investigation and full conversations with potential contacts so that we keep the spread as minimal as possible. So we are all, as local health departments, looking at that as a really critical step moving forward. Wonderful. Thank you again for being here today. We are happy that people are continuing to want to learn more about what's happening related to COVID-19 in our community. We'll be back on Wednesday, and we are looking forward to talking to you then.